45 minutes, an hour, sometimes never. And the whole time you're thinking, why can't I just finish? Maybe you're watching your partner's expression shift from pleasure to patience to something that looks a little like concern. Maybe you're in your own head, willing your body to cooperate, wondering what is wrong with you. If that's your reality right now, this video is specifically for you. Hi, I'm Dr. Ella Parker, certified men's sex therapist with over a decade of clinical experience working with men on some of the most personal, most misunderstood challenges in their sexual health. And today, we are talking about something that doesn't get nearly enough airtime: delayed ejaculation. Not because it's rare, but because most men are too confused or too embarrassed to bring it up, even with their doctor. That ends today. Before we go any further, if you're new here, hit that subscribe button right now. Every week on this channel, we have honest, research-backed conversations about men's sexual health that nobody else is having. No shame, no judgment, just real answers. Now, let's get into it. Why lasting too long can become a serious problem. Let's start by dismantling something. Culturally, we've been told that lasting longer in bed is the goal. It's the thing men brag about, the thing magazines write about, the thing that's supposedly the marker of a great lover. So when a man starts taking 40, 50, 60 minutes to reach orgasm or finds he can't finish at all, there's often this initial confusion. Is this a good thing? It is not. Delayed ejaculation, or DE as it's known clinically, is defined as a persistent or recurrent difficulty, delay, or absence of orgasm following sufficient sexual stimulation. The key word there is sufficient. We're not talking about an off night. We're not talking about stress from a hard week at work. We're talking about a pattern, a consistent experience where the body simply won't cross the finish line, no matter how long the race goes on. And here's why that matters. Sex that goes on far too long stops feeling like intimacy. It starts feeling like a workout nobody signed up for. Your partner becomes physically sore, emotionally disconnected, and you become increasingly anxious, increasingly frustrated, increasingly inside your own head. It's exhausting for both of you. For men over 40, this is more common than you might think. Studies suggest that delayed ejaculation affects up to 10 to 15% of men in this age group. And those are only the men who actually report it. The real numbers are almost certainly higher because most men don't report it. They push through, they hope it resolves itself. They don't say a word. And that silence, it makes everything worse. Let me tell you about a man. We'll call him Marcus. Marcus was 47, in good shape, healthy relationship. No obvious reason for any sexual issues. When he first noticed it taking longer to climax, he wasn't worried. If anything, he was a little smug about it. He thought he'd somehow unlocked a new level. His partner seemed to enjoy the extended sessions, at least at first. But 6 months later, the dynamic had completely shifted. His partner had started quietly pulling away from intimacy. Not dramatically, no big conversation, no argument, just less initiation, more excuses, the occasional headache. Marcus didn't understand what was happening. What he didn't know, what she hadn't told him, was that sex had started to feel like a chore, that she'd begun to wonder if she was the problem, that she was lying awake some nights feeling quietly and completely like she was no longer enough for him. Marcus wasn't broken. and neither was she. But without understanding what was actually driving his delayed ejaculation, and without talking about it, they were both suffering alone. That's the real cost of this condition, and that's exactly why we're here. The 5 real reasons it's happening. So let's get into the causes, because understanding what's driving your delayed ejaculation is the first step toward actually resolving it. Reason 1. Your medication may be the culprit. This is the one I want you to hear first, because it's the most overlooked and the most fixable. If you are taking an antidepressant, particularly an SSRI or an SNRI, there is a very real chance that your medication is directly causing your delayed ejaculation. SSRIs, selective serotonin reuptake inhibitors, are among the most commonly prescribed medications in the world. They are also among the most well-documented causes of sexual dysfunction in men. Studies suggest that anywhere from 30 to 40% of men on SSRIs experience delayed or absent ejaculation. And it's not just antidepressants. Beta blockers for blood pressure, alpha blockers for prostate conditions, opioid pain medications, antipsychotics. All of these medications that men over 40 are increasingly likely to be taking can blunt the ejaculatory reflex. Here's what I want you to do. Look at your prescription list and then have an honest conversation with your prescribing doctor. There are often alternatives, different medications, adjusted dosages that can restore sexual function without compromising your treatment. Do not stop your medication without speaking to your doctor, but absolutely have that conversation. The habit quietly rewiring your pleasure response. This one is harder to talk about, but we're going to because it matters enormously. Many men, particularly by their 40s, have developed a very specific masturbation style, a particular grip, a particular speed, a particular fantasy or type of visual stimulation that reliably gets them to climax. The problem? That specific combination of inputs has become the only combination that works. Partnered sex, with its different textures, rhythms, angles, and emotional dynamics, simply cannot replicate it. And so the body, conditioned over years of the same stimulus, struggles to respond. Clinically, we call this idiosyncratic masturbation. Colloquially, some refer to it as the death grip effect. Whatever you call it, the result is the same. Your solo habits have raised your stimulation threshold so high that real intimacy can't clear the bar. The good news? This is entirely retrainable. But it does require honesty with yourself and ideally with a therapist about what's happening. Reason 3. Your nervous system is changing with age. Here's the physiological reality that nobody explains to men in their 40s. The ejaculatory reflex depends on a finely tuned conversation between your peripheral nerves, your autonomic nervous system, and your brain. That conversation, which once happened in milliseconds, starts to slow down as you age. Testosterone levels decline. Penile sensitivity decreases. Nerve conduction slows. If you have underlying conditions like type 2 diabetes, high blood pressure, or metabolic syndrome, all significantly more prevalent in men over 40, peripheral neuropathy can further blunt the signals your body needs to reach climax. This is not failure. This is physiology. But it does mean that what worked at 28 may not be sufficient at 48. Your body needs more stimulation, more time, more intentional engagement to get where it needs to go. Understanding this reframes the entire experience. It's not that something is wrong with you. Your body has changed. and your approach to sex may need to change with it. Reason 4. Performance anxiety is feeding the loop. Here's the cruel irony of delayed ejaculation. The longer it takes, the more aware of it you become. And the more aware of it you become, the harder it becomes to get there. The anxiety itself, the watching, the waiting, the willing, creates a neurological interference pattern that actively suppresses orgasm. Your brain is caught between two modes. There's the parasympathetic state, calm, present, aroused, which is where orgasm lives. And then there's the sympathetic state, alert, anxious, monitoring, which is where performance anxiety lives. You cannot be in both at once. So every time you start mentally checking in, am I close? Is she okay? Why isn't this working? You are pulling yourself further from the very thing you're trying to reach. This is the anxiety loop. And for many men, it becomes the primary driver of their delayed ejaculation, even after the original cause has been addressed. Reason 5. Your brain has left the building closely related to performance anxiety, but distinct enough to deserve its own conversation, is a phenomenon called spectatoring. Spectatoring is when you mentally step outside of your own sexual experience and start observing yourself as if you're watching from above. You're no longer in the moment, you're reviewing it, critiquing it, monitoring it. Sex therapists first described this in the 1970s, and it remains one of the most common psychological barriers to male orgasm. When you're spectatoring, your brain is not processing pleasure, it's processing performance and orgasm, which requires a very specific kind of full body, full mind surrender. Simply cannot happen when part of you is standing in the corner of the room, clipboard in hand, judging the session. What she may be feeling, but not saying, I want to take a moment to talk about your partner. Because delayed ejaculation is rarely just a solo experience. It ripples outward. And the person it ripples toward most is the person in bed with you. Here's what the research consistently shows. When a man cannot reach orgasm during partnered sex, his partner, particularly female partners, frequently interprets it as a reflection of her attractiveness, her desirability, her adequacy as a lover. She may not say this. In fact, she probably won't. But she may start to feel it quietly, persistently, in a way that slowly changes how available she is to intimacy. She may initiate less. She may find reasons to avoid sex. She may become emotionally distant in ways neither of you can fully articulate. And you, confused by her withdrawal, more anxious than ever, perform even worse. The loop tightens. This is why communication is not optional, not a nice to have, not something you get to when things are really bad. Having an honest, calm, non-sexual conversation with your partner about what you're experiencing, framed not as a confession but as an explanation, can transform the dynamic almost immediately. I've been struggling with something. It's not about you. I think I understand what's happening, and I'm addressing it. That one conversation can stop months of silent damage. Section 5. What actually works? Evidence-based solutions. Let's talk solutions, because this is treatable, highly treatable, and the research is clear on what actually works. 1. Medication review. Start here if you're on any of the drug classes we discussed. Talk to your doctor. Ask directly whether your prescription could be contributing to delayed ejaculation. Request alternatives if appropriate. 2. Sensate focus therapy. This is a structured, evidence-based exercise developed by Masters and Johnson. It progressively rebuilds the sensory pathway to arousal, removing performance pressure and reestablishing pleasure as the goal. It is one of the most effective interventions for DE, particularly when anxiety is a driver. 3. Masturbation retraining. Working with a sex therapist, men can gradually recalibrate their stimulation threshold. This involves intentionally modifying solo habits, reducing grip intensity, slowing pace, introducing partnered stimulation earlier, over a structured period of time. It requires patience. It works. 4. Pelvic floor work. The muscles of the pelvic floor play a direct role in ejaculation. Dysfunction in this area, whether weakness or excess tension, can significantly impair the ejaculatory reflex. A pelvic floor physiotherapist can assess and treat this directly. 5. Sex therapy and CBT. For psychological drivers, anxiety, spectatoring, relationship dynamics, working with a qualified sex therapist is the single most effective intervention. Cognitive behavioral approaches help men identify and interrupt the mental patterns that are blocking orgasm. 6. Hormonal assessment. If low testosterone is a contributing factor, your doctor can assess this with a simple blood test and discuss appropriate treatment options. Here's what I want you to take away from today. Delayed ejaculation is not a character flaw. It is not evidence that you are less of a man. It is not something you should be able to fix through willpower or distraction or just trying harder. It is a medical and psychological condition with identifiable causes and evidence-based treatments. And the men who get the best outcomes are the men who stop suffering in silence and start getting informed. You are not broken. This is far more treatable than most men realize. But, and I say this with complete sincerity, the worst thing you can do is stay silent and hope it fixes itself. It won't. The anxiety will grow. The distance in your relationship will widen. And a problem that was entirely solvable at the start becomes significantly more complex 6 months down the line. So take the first step. Talk to your doctor, talk to your partner, reach out to a qualified sex therapist. You don't have to navigate this alone. If this video helped you understand what's really happening, please share it. There is someone in your life who needs to hear this. A friend, a brother, a colleague who is quietly going through exactly what we described today and has absolutely no idea where to turn. Share this video. It might be the most useful thing you do for someone you care about today. And if you haven't subscribed yet, do it now. Every week, we're here having the conversations that actually matter for men's sexual health. No shame, no filters, just real, clinical, compassionate information. I'm Dr. Ella Parker. I'll see you in the next one. See